All right, I was just looking up integrate, talking about integrative medicine. It's a funny term, integrative medicine, because what are we talking about? Integrating what? It used to be called alternative medicine, complementary medicine. And what are we trying to define here? You know, what are we complementing? In fact, all medicine is an alternative to another medicine. So I don't know that any of these terms work very well. We're in a process of change, I think, in medicine. You know, the 20th century was the century of the pharmaceuticals. The 20th century was major advances. And I'm not a Luddite, and I'm not a conspiracy theorist. I don't believe that the pharmaceutical industry, medical industry is evil. But I think a lot of the advances that were made have been made, and we need to move in a new direction. I think the 21st century is this exciting movement. Integrative is okay, as long as what we generally call complementary medicine isn't in the junior seat in regard to these things. So there is a change occurring, and we need to really look at what orthodox medicine is and some of its shortcomings without condemning it. I mean, if it weren't for antibiotics and vaccinations like smallpox and polio, how many tens of millions or even hundreds of millions of people would be dead because of its absence? You know, I think that really orthodox medicine, the pharmaceutical industry, has contributed enormously to well-being and health. And we're in a state of change. So how do we define that change? And what are the issues that are arising from this sort of thing? I think it's difficult to actually say where we will go. I think what's exciting is knowing that we're going someplace new. So if we look at orthodox medicine, what we're looking at is a system that is based on, well, proposed to be based on evidence-based medicine. And I think there's a place for evidence-based medicine. And certainly it is critically important that we establish real understandings about medicines, whether they be pharmaceutical drugs or herbs or supplements, compounds. We do need to have this. There's no doubt about that. But there's also both limitations to evidence-based medicine and limitations to the access to doing the research. For example, people often ask me in regard to the herbs that we use in Chinese medicine, Ayurvedic medicine, Western herbalism, is it based on evidence? It's easy to do trials. We do a lot of trials in vivo and in vitro. We do a lot of animal studies. But to actually do a full clinical trial is an enormously, extraordinarily expensive process, and no one is going to put the money into this, or very few people are going to put the money into these kinds of trials. Does empirical evidence count? I think it does. I mean, what is empirical evidence? Empirical evidence means that somebody's been doing this for millennia, and that they've actually found that it works. Now, often these traditional medicines, and we're talking here again about Chinese medicine, Ayurvedic medicine, and traditional Western herbal medicines, what we're looking at is a long history of the application of things, but they have their own nomenclature. You know, for example, in Chinese medicine, you're looking at concepts like pattern discrimination, damp, yin, yang, and so forth like that. These give us clues as to how the people saw disease and the application of disease and how those diseases were treated within the confines of their medicine. It is both relevant and irrelevant today in the era of evidence-based medicine. It allows us to recognize that there is no one single disease, but rather there are variations based in this disease that are manifested in these patterns. And Western medicine tends to want to work, Orthodox medicine wants to work in very defined areas. There is this disease, and then there has to be this treatment. Traditional medicines recognize that there is a presentation of a disease which has different variations based upon the individual patient's condition. So is this pattern discrimination, or the ways in which we look at this, valid? Yes, it is valid, because it tells us that we're not just dealing with a disease, but we're dealing with a patient who manifests the disease. Yeah. It's an interesting thing when we talk about disease, because what we're talking about is what's gone wrong. And so easily you and I, practitioners of all kinds, tend to focus unnecessarily upon what's gone wrong. And of course that's what the patient comes with, is their disease. But really, I think that disease is expensive, but health is actually free. And I encourage all of my patients to stay healthy, remain healthy, and do those things that cause them to sustain health. However, when people get sick, we need to define that. Orthodox medicine defines it according to a series of patterns: type 2 diabetes, insulin resistance, clinical depression. These are names that are a collection of symptoms. But if you look at things like, for example, depression, for example, there isn't a single condition called depression. There are myriad conditions. Perhaps a dozen different conditions we call depression. So it isn't a single thing. So when we begin to define disease, we actually really need to look at, what does disease mean? I mean, I understand dis-ease means unease. But really what we're looking at is the body's adaptation to some kind of pathology. You get a fever. The fever is the immune system's response to a pathogenic agent, virus or a bacteria. Or you may get an overreaction of the immune system, an autoimmune disease. You get depression. Depression is the result of unsustainable kinds of strains on a person's life. I think one of my professors once said about depression, depression means you need to go to a dark room, close out the world, and actually examine your life. So depression isn't disease. Well, if depression isn't a disease, but rather a syndrome that arises from wrong living, I would extend that greatly even to cancer. Because I think cancer is not a disease. As I said earlier, diseases are those things that happen about the immune system. They are responses in the immune system, overreactions in the immune system. It is the body's attempt to deal with pathogenic factors, exogenous factors or endogenous factors, nutritional factors. And the body either adjusts and comes back to a state of homeostasis, or it doesn't, and then it fails. But cancer is a different thing, because cancer isn't classically a disease. It is the breakdown of order over a long period of time. Many cancers take 20 to 40 years to actually manifest. And when we say the word cancer, we think about a disease. But in fact, there are over 200 different kinds of cancer. And you put that together with the individual's age and condition and vitality, their own psychology, looking at other factors, other kinds of physical impairments. And you see that cancer is not just a single thing, but rather a complex system of disarray. In Orthodox medicine, cancer is considered a disease of the cell, a breakdown in the order of the cell. And I think that that's fair enough, but I think we need to actually investigate what we mean here again by disease. Cancer cells are immature cells. They just don't grow up. And often when I talk to my patients, I talk to them in regard to, well, the metaphor of a culture.